Let's get started with few introductions. I'll first introduce Ms. Faye Forteza. She's our regional director for the nursing program who has almost 25 years or more of experience of being in the field and in training nurses. I'll also welcome Crystal Gounder. She's our guest speaker who is a practical nursing supervisor at Wellness Infusion Clinic and NAS Pharmacy. She'll be shedding some light on the role of practical nurses in the healthcare world. We will be covering the few things in this presentation or in this virtual event. First would be why choose Vancouver Career College? What services does Vancouver Career College offer? What do practical nurses do in the real world? And then we'll have our guest speaker, Ms. Crystal Gounder, who will be giving an insight into the actual real world of practical nurses and how do they get hired and what is expected of them. In the end, it will be followed by the question answer session. So let's get started with why choose Vancouver Career College. The first and the most important thing is that with our program, it is online and on campus in a way that you will be able to do all the prerequisites online. So you don't have to take time off your work or change anything in your work schedule to do the courses. However, the main program, the nursing program, once you start the nursing program, it will be in campus. It is Monday to Friday, 5 hours a day. There are different schedules available depending on what is your availability. We offer practicum placements. So the program is divided into 4 semesters, and each semester, the courses, once you finish all the courses, we send you to a practicum site to actually put into practice what you have learned through the courses at the campus. The idea is that you are not, you are really prepared for the real life world once you complete the program and pass your board exam. There is no wait list. Depending on when you apply for the program, what prerequisites you need, you can get started very soon. You don't have to be in a waiting list for a year or 2 years to be able to start on your career. You can graduate fast. So obviously, if you will be able to start the program early, you will be able to graduate fast as well. It is hands-on training. As I mentioned, that we do have practicums at the end of each semester. So you're putting into practice everything that you've learned through that semester. And the other major advantage of that also is that it helps you to retain knowledge, because when you do hands-on training, studying from book is one thing, but when you put that into practice, your retention of that knowledge is way better, which also comes handy when you're writing the board exam. We have very experienced teachers or instructors who take you through the program. All of our instructors are licensed professionals and they have years of learning and teaching. And you will be able to gain a lot from their experience. They're not only good academically, they're also very good instructors in terms of imparting knowledge. I'm sure some of you would have experienced that you've had some teachers in your life who are academically very sound, you know that, but they're not able to impart that knowledge to the students. Our teachers have an expertise on both. They are academically very sound and they're also very good instructors. They can go down to the students level to make them understand what they're teaching. And then you have personalized instruction. By that, what we mean is that our teachers are very invested in your success. Our class size is small. The class size is anything between 24 to 28 students. So you get a lot of one-to-one with the teacher. And if you need any individual help, the teachers are always there to help. Now, to be able to achieve all the good things that I just told you, we have few services or different teams of individuals available. The first is the student services team. So the student services team is there to answer questions regarding your attendance, your academic success, and the school procedures. They are available throughout your journey as a student with us. every step of the way. They not only are available to tell you the policies and the procedures, but they're also available to advocate for you in various situations if there is something that is not the way it is supposed to be, either they will be able to explain it to you why, or
You're on mute. Rito, you're on mute.
The second would be the career services team. The career services team, they're basically to help you find. Can everybody hear me now?
Yes.
Okay.
Yeah.
All right.
Yes. Yeah.
Okay. Okay. So the career services team is there for helping you to get the employment at the end of the program. And in some of the cases, if Vancouver is so superly expensive, if some of you are looking to get a part-time job while you're going to school, we can also assist you, or the career services team will also assist you in finding a part-time employment during the school. They would be available for you 6 months even after you graduate if you're still job hunting. However, that being said, please believe me, none of our nurses have to wait for 6 months to get a job after they graduate and they pass the board exam. As Faye would also mention, and I heard in one of her presentations, if a practical nurse leaves her job today, she will get hired tomorrow. There's so much of requirement in the real world these days. They would also help you with your resume building and preparing you for the interviews. Then we have a financial advisor team, because you can't go to school without the money. Very important. So the financial aid team, it's a team of experts who will walk you through step by step how to get funding, how to apply for it for your education. So when you come to the campus, you meet with them, they will tell you how to budget and how to apply for various funding, whether you're looking for a bank funding or you're looking for the student loans. They will be there to help you with that. Education support, which is where our instructors come in. They're available to provide you a tailored guidance and to answer all your questions related to the program, related to the courses that you're taking while you're at school. Now, I would like to welcome Ms. Faye to share how does the world of nursing looks like, and what is expected of you as a practical nurse, and how do we as a school assist you in getting there successfully. So, Faye.
Thank you, Ritu. Slide, please. So I'll discuss to you what practical nurses do and who are they and what are the needs for the practical nurses. So the practical nurses, they provide care services within their defined standard and scope of practice to patients based on the patient assessment and care and planning procedures. They perform nursing interventions such as vital signs, applying aseptic technique, including sterile dressing. So I always, from semester one, from the simplest to the complex nursing procedures, infection control, monitoring nutritional intake, conducting specimen collection, administration of medication, and observe and document therapeutic effects of the medications you've given. They provide preoperative and postoperative personal and comfort care. This is during surgery. Monitor established respiratory and intravenous therapy. They monitor patients' progress, evaluate and document effectiveness of nursing intervention, and collaborate with other members of the health team. So the LPNs are really a vital part of the healthcare team. Provide safety and health education for individuals and their families, and they get hired in various areas of the healthcare field, like in the clinic. They can work in acute care, they can work in palliative care, hospice. And after further education, they can be OR nurses, they can be foot care nurses, dialysis nurses, and so on and so forth. So LPN is the second largest nursing group in Canada. Right, last 2 weeks ago, I got an email saying that they need about 3 to 4 thousand nurses in the north, and they're willing to give sign-up bonuses. And so, like Ritu was saying, if you get a job today, maybe same day you can get a job somewhere else. But it's highly regulated under the nursing legislation of BC and the College of Nurses in BC. The mandate of the LPN is public safety, client-centered care, and ethical care. So I always say during orientation, I said if this is a different kind of, it's not a career, it's mostly a vocation, because if you make a mistake, unlike accounting, if you make a mistake in calculating, you can restart again. But in nursing, once you make a mistake, you can kill somebody. So we really train our students well, and we have well-trained instructors to make sure that the students are well-trained, because when they take them to the clinical, they will work under the instructor's license. Next, please. Next slide. Okay, so what's the importance of in-person learning? We had a hard lesson that we learned during pandemic, wherein most of our students are online. And so there's so many disadvantages of being online, because what we have found out when we analyze, the passing rates are low. They cannot connect the theory to clinical. So we had said that, okay, these are the advantages, because since the instructor can offer real-time insights to students to help them understand, while gaining the ability to receive instant feedback on the quality of their instruction and to improve themselves. It's highly interactive, wherein they can help each other. It provides a space for instructors to interact with students to improve their class success rate. And we have seen that change ever since we have brought them back to class. Ideas and opinions can also be promptly shared with fellow learners through group discussions. And there's a lot of collaborative and feedback, and you create a space, a working space among the group. I always encourage to have a buddy system, or that you have a study group, because if you miss something during the discussion, somebody else will be able to supply those information. And the IT is always available if there is a glitch in the computer. We have a computer lab. If you don't have a laptop, we have a computer lab in each of the classrooms at Vancouver Career. Next, please. Other benefits. Okay, so we do accommodate students with some kind of disability, but with proper medical documentation. And plus, they have to meet the risk. So requisite skills and abilities for students. So tutorials is available. Like I said, sometimes it's hard for the students to connect the theory into hands-on. So there's if the student misunderstand something in the theory and they cannot apply it hands-on, there's always somebody available. The instructors will be there. The instructors work with you side by side when you're in the lab. And if you miss anything, you can always come back, and we have an open lab. We encourage students to actually practice. You can make all your mistakes in the lab. So we expect when you go to the clinical, you've got it all covered, and so you will not make any mistakes in the clinic. Well, there's still some who made mistakes, but we have the clinical instructor there for you to help you. Hands-on training, like I said, again, it's more effective than just video, just watching your videos. Next, please. Okay, so this is a testimony of one of, there's another testimony of one of the students. And I'm sure Crystal have the same thing that she will say, that it's the ability to connect with other instructors while you're in the classroom, and they make lifelong friendship. And another thing is, Rita already mentioned about small classes. The schedules are given to you ahead of time, so you can actually plan your life outside school. Most of our students are either married or they have children that they have to look after. So that's a good benefit for the students, that they know ahead of time for the schedule. Next. Okay, so this program is 75 weeks, 18 months, again in person, and it's divided into 4 semesters, delivered, and each is one is built on the previous to foster emergence of the new knowledge, meaning it's a spiraling curriculum. So again, from simple to complex, but then that simple goes from one semester to the last semester. And the example of the courses that you can see on the slide, integrated nursing practice and consolidated practice are all hands-on practice, and the rest are all theory practice. And they will have it on from semester 1 to semester 4. Oh, another thing is a successful completion of semester 2. The college will assist you or the student to apply to have an HCA registry number. So you can actually have that HCA registry number and work as an HCA. So that paper of completion will have to come from the college, that you're allowed to work as an HCA part-time while you're going to school. And that's all. Thank you very much.
Thank you, Faye. I'm going to just mention here that I can see that the students, all of you who are there, you have some questions. We will take the questions at the end of the presentation after Crystal's session. So now I would like to welcome Crystal Gounder. She's going to take you into the workforce, share her experiences as a student and as also somebody who hires practical nurses, trains them. So she's going to go over what is expected to you once you become a nurse and you enter the workforce. I give it to you, Crystal.
Hi, everybody. My name is Crystal Gounder. I am the LPN supervisor at NAS and Wellness Pharmacy, as well as the Wellsprings Infusion Clinic. So I am a graduate of CDI. We can go to the next slide, please. I am a graduate from CDI, and this is kind of the agenda we're going to go through very briefly. And the next slide, please. So I'll be going through kind of what we're looking for as an employer, kind of the things that we go through with orientation, interviews, as well as kind of my experience working and going to school with CDI and Vancouver Career College, just being in the LPN program in general. So we can go to the next part. So for this hands-on experiences, I don't know how everybody else learns, but for me personally, I am somebody with hands-on experience. We can stay with the next slide. That's okay. So I am somebody who learns with hands-on experience. So we'll go through the theory, we'll go through all of the other steps of it. Oh, Ritu, we can go to the next slide.
Okay.
Thank you. And so it is very different. So some people are very theory-based, some people are very memorizing, like memorizing is their expertise. I definitely am somebody who wants to go into labs, go into clinicals, speak with my patients, interact with my patients, do the hands-on skills. So I know what I'm learning to make sure I know my skills. And that is the benefit with hands-on training. The other thing is when you do have a classroom where it is smaller, where you're able to interact with your peers, when you're able to interact with your teachers, it gives you the sense of confidence. It gives you more of a easier time learning, taking on new skills. it's great to be able to have a community to fall back on, to reach on. I know Faye had talked about working with your classmates to have study sessions and working with them when you're missing notes. During the program, a lot of us did lean on each other if we were ever absent or missing a class, or if you had to leave early, or if you missed something. That's where the community really comes in. So the teachers are great. So we did talk about how the teachers are great instructors, but they also have lived experience. So a lot of the instructors that I had, I think every single instructor I had in my LPN program, they also worked in the field. So when they're teaching you information about patient care, conflict resolution, they're talking from experience as well. So we do go through the textbook, we go through the theory, but they also reinforce it by sharing stories, sharing experiences. And that is something that I retained throughout the program was, if I'm in a situation like this is kind of how I would go about it. They are also very upfront. They don't really sugarcoat everything. There were times in the program where I would ask them a question and they'd be honest and they'd be like, these are the challenges. Sometimes it's family members, sometimes it's complicated medical issues, sometimes it's scope of practice, dealing with BCC&M, they have this experience, and that's why they're teaching the program. And they have all of the tools for you to use and the resources. One thing throughout the program was, if I'm asking a question, they would make sure that I found my answer eventually. So if I asked a question during class and they didn't necessarily have the question on hand, they would talk with their colleagues, they would talk with their other resources and get back to me, which was really appreciative because I am somebody who is a what if person. So I'm like, what if my patient says this? What if my patient does that? What if a family member does this? What if I'm in a situation like this? Because I do want to be prepared. Nothing can compare to being in the workforce. Nothing can really prepare you for becoming a nurse. But there are all these situations where you're like, what if something like this happens? And it's reassuring to know that the people who are educating you have gone through similar things. One thing that I really enjoyed was having lab days. Lab days gives you the opportunity to really put in that effort and put all of that knowledge that you had learned during the theory session and give you the opportunity to problem solve, critical think. It gives you the opportunity to make mistakes in a safe environment. The worst you can do is probably drop one of your dummies that are in bed. There's not there's not a lot of things that could really go wrong in a lab session. So it gives you kind of the freedom to explore, be creative. Sometimes you run into problems. So some of the problems could be people's dexterity, people's mobility. It could be somebody's too heavy, somebody's too light. These are all the situations that can come with lab, and it gives you the opportunity to really break it down into different sections, work with your classmates, brainstorm together, and your instructor is always close by to kind of monitor, ask questions, and instead of really giving you the answer, we all work as a team, which I really appreciated because it really did let me work the problems out myself so that when I did go into the hospital, when I did go into long-term care, I was able to problem solve because I was given the opportunity to do that in the classes. So one thing with having hands-on experiences plus a smaller class size means that you're not lost in the crowd. So I am somebody who's come from bigger schools or different schools in different areas, and you kind of get lost in with everybody else. The main thing to take away from a smaller class size is your teachers are able to know you specifically, know your needs, know your learning style, know who you are. Whereas with my previous experience, I was just another hand that was raised, or I was just another head in a crowd. Sometimes it's an auditorium, sometimes it was just a very large class. And then also when you're in a situation like that, after hours for teachers, it's a huge lineup. You're standing in line trying to get answers to your questions, and everybody's competing for your instructor's times. But with a smaller class size, you don't really run into that problem because it's very individualized care. They do accommodations, they meet you in the middle. They really do try to make sure that everybody succeeds. And you're not always going to graduate with everybody you go into the cohort with, but you do build relationships with your instructors and your classmates. A lot of times, even after you graduate, people stay in touch. People go back to the school that they graduated from. People stay in connection with the other classmates and other people that they worked with, which is a great thing to have. And that's where the community comes into play. And what we look for, we can go to the next slide. So this is kind of based off of me as an employer. So I do the hiring for my company. I do all of the interviews. I do have a HR team that filters all of the people who are qualified to work the job. And then I go through and make the final decision. I do the final interview on who we will hire and who we will not hire. The main key point is to know the company that you're applying for. So I've had plenty of opportunities and situations where people were applying for the job who had no idea what they're applying for. So a little bit of background, we are a home monitoring program. So we send nurses and care aides to the homes of our patients. They drive house to house. They witness medication, they do injections, they do things like that. And I've had applicants who don't drive, who don't have a car, who aren't comfortable working by themselves, aren't comfortable going to patients' homes. And obviously, when we're getting we're getting people interviewing for positions, we're wanting to make sure they actually are wanting to work in the position. So before you send out resumes and applications, know if this is something you want to do. It's easy to send in a resume, but be particular, know where you're sending it to. If it's not something you enjoy, it's not somewhere you want to work, then there's plenty of opportunities. Nursing positions are in demand, so you definitely have places to choose from. The other thing would be to anticipate common questions. So I have been a graduate for some time now. I graduated in 2022, but I do have 6 to 7 years of experience working in healthcare. I started as a support worker, I moved up to a care aide, and now I am an LPN. So I've worked with many companies. I worked at different facilities in different cities, all over the place. So everywhere from Hope to Vancouver. So I am very familiar with the interview process. And there are definitely common questions that are frequently asked. And a couple of them are basically, what are your strengths and what are your weaknesses? I've gotten that plenty of times. I think it's easy for a lot of people to give me their strengths. They know their strengths. The difficult one is, where are your weaknesses? I have had many people struggle to answer that question or not answer that question at all. I've gotten it at other companies as well. So know what your strengths, know what your weaknesses are, rehearse those responses. The other one is, know your experience, be confident with what you bring to the table. A lot of times people will ask, what are some of the qualities that our company would benefit from? Or what are some of your experiences with stress levels? Or how do you handle situations like this or that? Know your experience and be confident in where you've come from, what your experience has been for those reasons. So the other part is ability to answer questions. A lot of times people get really anxious when it comes to interviews, for good reason too, especially if it's a job that you want. Whether it's for my company, Fraser Health, or a different authority, if it is a job you want, you are really excited to work there. You will be nervous. You want it to go good. But oftentimes your anxiety is the reason why you're going to not think clearly. You're going to be very jittery. You're not going to answer questions properly. So one thing is the ability to answer questions. Take a break. So if I ask you a question, hey, what are some of your weaknesses? Take a pause and think it through, right? You can have water next to you, take a sip, breathe, and answer the questions. I think a lot of times people will try to rush to answer a question quickly, and they're giving me answers to questions that aren't even relevant to what I asked. So that's something to be mindful of, right? So when I ask you a question, take a step back, think about it, answer. There's nothing wrong with a pause. It's not a rush to see how many questions you can answer quickly, but to answer the questions to the best of your ability and not rushing and remaining calm will be a huge reason why you would pass an interview versus fail one. The other one would be critically think. So there's simple questions like, are you experienced in this? Have you experienced that? Yes and no questions. The other ones are scenario-based questions. So when you're working in healthcare and you're applying for jobs, a lot of the employers will ask you scenario-based questions that are very relevant to what the actual job role will be. So one thing would be, if I'm hiring for a certain position, I will ask you a scenario-based question. For example, you are a nurse visiting a patient, you enter the home and a person's laying unconscious. What would you do? Right? So it's a very simple question, but there's so many steps to it. You want to be thorough with how you explain what you would do, but also what you're thinking, what are your concerns, and go through the list of all the things that you would do in those step by step. Right? So that's part of the critical thinking, where the scenario-based questions are where a lot of people trip up. They're forgetting key concepts, or they're avoiding the big risk factors or the big concerns, and stressing over the superficial results. So those are something to be mindful of. The other one is speak clearly and concise. This is just to better your opportunity and your chances of passing an interview, as well as show personality. I think some people forget that there's so many people who are going through the hiring process that we're not trying to answer the questions exactly to what the employer wants. You want to show personality. You want to show them that you are different from the other people who are applying, and your background and your expertise and your education, your personal information is what's going to make you stand out from the rest of the people. Nobody has experienced the things you've experienced, and that is what will help you move on to the next part of it. So once you've passed the interview, I think a big misconception is once you've passed the interview process, you're good. There's nothing left to do. You've got the role, everything is settled, which is not the case. After you get hired is where I will pay the most attention to. Because again, there's usually a period of time where it's a probationary period, right? So they're trying to see, do you mesh well in the operations? Are you good at what you do? Are you able to pick up skills? And that's where I want to make sure that the people that I hire are actually good employees who are able to work hard, who are able to work well with the systems that are already in place. So when I do take on a new hire, we do orientations, which most companies will do. So during the hire orientation process, that's where I'm paying attention to see how well are you picking up information. I want to know how much information you can retain. I'm going to focus on how well you're communicating, because a huge thing is once you get hired, I've had it where people don't communicate with us anymore. So it's hard for us to reach them to get paper signed. They're no longer communicating properly with the head office or with the team. So that's something to be mindful of. Like, we still want to continue to communicate well, because that's showing the operation that you are able to communicate. You are being responsible. We also want to make sure that you are able to succeed in this role. And for us to do that, we have to regularly communicate with you when you first get hired. So having communication throughout the hiring process, as well as after you get hired, shows the employer that you are dedicated to the role, that you are available for communication. And I'm not saying you have to answer every single phone call as soon as they phone you, but I'm saying respond back, especially if they're asking you how well you're doing, if you have any questions, if you have any concerns, if it's communication in regards to patients with other interdisciplinary teams, things like that. So communication is huge, and we want to continue to have communication even after you're hired and even after you're given the offer letter. The next things I'm looking for are interactions with patients. Patients are the main reason we are here. So I'm gonna be paying attention to how well you're interacting with the patients, how well you're able to use the skills you've learned in classes in your past experience, as well in the orientation to help the patients. Advocacy is a huge thing. So even if you're a new person onto the team, we still want you to advocate for your patients. We want you to be able to help patients with their day-to-day needs, depending on what the role is anyways, but their main priority is I'm going to be watching how well you interact with our patients. The other one is how well do you work with your coworkers? You could be a great nurse. You could be a great nurse with 10 to 30 years of experience, but if you are not able to work in a community team, if you're not able to work with coworkers, interdisciplinary team members, you might not be the best fit for the role. And that is a red flag that I would pay attention to when I am hiring people. You can be a great nurse, but the main thing would be to be able to work well with others as well as work well with your patients. So some final tips and takeaways. We work together in a team to build, understanding, develop skills for your future. So we're building this relationship in the college that you're going to carry through after you graduate as well. And then the universities do create a safe learning environment, because we need to have a safe learning environment for us to question, for us to make mistakes, for us to correct our own self, right? And for us to build the knowledge and the skill level to be able to work into the job that we're applying for. One thing is people forget that we're not going to school to graduate. We're not going to school to pass exams. We're going to school to actually learn how to be in the role that we will be applying for. So that's a big thing that we go about is as a employer, I do see the people who went to school just to memorize and they don't have that context available to put these skills into actions. They know how to memorize information, memorize skill sets, but not really put that into taking care of patients and putting it into the workforce. Whereas people who went to school and actually took the time to learn how to do a skill and apply it into different contexts, right? So when you're going to school, we're going to school to learn how to be in the roles that we're going to be on. Hands-on learning helps students master their skills before entering the workforce. And I think that's a huge thing for the schools to be able to provide our students, is to give them hands-on experience so that they know what they're getting into before working with actual living patients, before coming into the workforce. It's being able to know what to do, how to do it, and build confidence around it. And then I gave you some tips and tricks on how to do interviews, what to do after interviews. And if you have any other questions, I'm more than happy to answer them after this presentation. And this is my contact information. You're more than happy to contact me directly, or you can call my office and ask for Crystal. I will respond to all emails and any messages left over the phone. I think you're mute, Ritu.
Hello?
Hello?
Hi.
Hi. Okay, so can you guys hear me now?
Yes, we can hear you.
Okay. All right. So I'll go over the questions one by one. Some of you have put it in the chat. I'll take those questions first, and then as and when you have questions, you can keep typing in, and then I, Faye, or Crystal would be very happy to answer them. So the first question I see here is it is from Hubert, and his question is, what are the qualifications I need to qualify for the enrollment? So Hubert, the requirements, the prerequisites for the program is you need to have English 12, biology 12, anatomy and physiology for practical nurses, and math 11. If you have these courses, good. If you don't have them, you can take it with us. These courses are available online. However, for the students who do not have 3 or more years of continuous face-to-face education in an English-speaking country, they also need to meet a proficiency requirement for English, which is the English IELTS exam. You will need to take IELTS academic. So that being said, the intake for nursing is kind of complicated. I would recommend to all of you who are here, who are looking into this program or who are doing their research, it will be advisable and recommended that you meet with me in person, come with all your transcripts, and then you will get a real idea as to which courses you need to take. But to give you a bigger picture, this is what you need. The next question is from Joanne. Is it a full-time in-person learning? Yes, the nursing program is full-time, Monday to Friday, 5 hours a day. It is considered full-time. The prerequisite courses are the only courses which you can take online. They are self-paced, so you can do it in your own time within the calculated number of weeks. So each course is 3 weeks to 4 weeks, depending on which course you're looking at. We do have different schedules though. We do have morning classes, which is Monday to Friday, 8 a.m. to 1 p.m. And we also have evening classes, which is Monday to Friday, 5 p.m. to 10 p.m. The next question is from Elisa. Her question is, how long is the program and when is the next intake? So the program is 18 months or 75 weeks, as Faye mentioned. We do have few intakes in a year. Depends on what prerequisites you need. How soon do you complete those prerequisites? And then you can get a spot in the class. So again, I'll go back to repeating what I said earlier. It is complicated. It is totally different for each student, depending on what prior education and experience you have. So it'll be a good idea to meet in person and go over everything. Next question is from Hema Choki. Her question is, what if the student is in healthcare aid already? So if you're in healthcare aid already, you will still need to go and take the full program of 18 months. But we do have graduation scholarships for the students who are already healthcare aid. And they have 600 or more hours of experience of working in a facility and are currently registered with the NCA registry. So you do get benefit in terms of scholarship. You save about $7,000. And also one thing you want to keep in mind is that nursing program is not like healthcare aid where you complete the program, you graduate and you can start working. Nursing is, even after you complete the program, you have to pass the board exam. So the healthcare aids, our experience is that the healthcare aids, you guys are very good practically, but nobody remembers the theory. So if you get into a program which is specifically meant for healthcare aids and it's a shorter program, you might end up having a problem, or you're basically doing a shortcut and you might have issue while you're writing the board exam. What I'm trying to say is when you take the full program, the chances are that you're better prepared to pass the board exam.
Yes.
Next question. I'm going to go to the next question. It is from DeAndre. What is the process to bridge to an RN from LPN? Faye, do you want to answer this?
Bridge to an RN to an LPN. Okay, like I said, there are a lot of schools who offer the access program to pathway to RN. There is the VCC, there is Quantland, and there's UBC. The thing is, still have to get your LPN credentials assessed by these schools. I know BCIT has a fast track. I think they have a 3 years or a 2.5 years. If you go to BCIT, again, like I said, you have to be assessed with all your LPN credentials. There are some who are crediting some of the courses from the LPN, but it depends on the school where you go to.
Thank you, Faye. So the next question is from Hamida. Her question is, do you have a 1-year LPN program and also do you have online? Hamida, LPN, it is a licensed program in BC in Canada. So we do not teach you what, or no school can teach you what they want to teach you. We have to teach you um, what is mentioned by the board, because you're going to be writing the board exam. So the program is 1.5 years. There are no online classes. You have to take it in school, in person. Um, the board exam, you are better prepared for the board exam if you take the full program and if you do classes in person, because you also need to learn a lot of things practically. Next question is from Joanne. I live in Sunshine Coast, 40 minutes away from Van City through ferry. In-person learning does not work for me. Thank you, though. Okay, thank you, Joanne. At this point of time, we do not have online program, unfortunately. Next question is from Neda. What is the difference between registered nurse and practical nurse? So apart from the fact, Neda, that the practical nursing is 18 months, you can start right away and you can potentially start working as a nurse in about 22 months. The registered nursing program it's 4 years program. Nobody actually finishes in 4 years. You're looking at least 5 years. You are looking at least 2 years of waiting list and very many prerequisites to do before you can even apply for the program or apply for a spot in the program. I'm going to ask Faye to get in if you have anything else that you would like to add, Faye.
That is very true. So sometimes I had a few people have come to me about deciding whether they be an LPN or an RN. I said it depends on what your needs are in your life. I said I would suggest LPN is a shorter program. You can work as an LPN, and then while you're working as LPN, earn your LPN, get your experience, and then in the future you can upgrade or do a pathway for the RN. There are some schools outside BC, or there are some BC schools that are offering online courses for some of the modules in the RN program. So you can be an LPN and then work towards your RN pathway.
Thank you, Faye. Next question is from Hasnia. The question is, what are the prerequisites for this program? Is there any required courses from high school? I did answer it before: English, math, biology, anatomy, physiology, and IELTS in case of students who do not have 3 or more years of face-to-face full-time education from Canada or from any English-speaking country. There are really no required courses from high school. If you are a mature student, you're 19 years older, you can take these courses with us. Next question is from Jennifer. Do you have a program for international registered nurses to practice in Canada? And if yes, when is the next program? No, we don't have any such program, Jennifer. We offer the LPN program as we went through the slides. That is the only program we offer right now. And I would also suggest you, Jennifer, and I'm sharing this from my experience of having worked with students for almost 16 years. I've spoken to thousands of students, and I met with lots of internationally educated nurses. I do not know how long have you been in Canada, but the sooner you understand that the best country that Canada is, unfortunately, our credit granting system for internationally educated professionals, especially in healthcare, still needs lots to be done. So that's a very, very long process. You'll be better off starting a career with taking all the education, which is not a long education, 18 months, and start working. That's my recommendation. Anyways. Next question is from Neda. Is it need English exams such as IELTS? Yes, I already mentioned that if you not have education from English speaking country, you need IELTS, and you need IELTS academic, overall band of 7, 7 in listening, 7 in speaking, and 6.5 in reading and writing. We have a question from Jennifer. Is full government-funded LPN program available? No, we don't offer any government-funded programs as of now. And then I have a question from Fung. how much is the tuition of the whole program? The tuition for the full program is 37,000 approximately, including books, tuition, taxes, practicum, all the material and everything. For the healthcare aid students who already have healthcare aid and who have 600 hours of experience, they do get a graduating scholarship of $7,000, $7,253. Next question is from Jav. How much costs it to graduate? I already said that. For people with work permit, how can they apply? So students who are on work permit, you cannot take this program. You will have to change your visa to study visa because it's an in-campus program. You will not be able to study it in open work permit or closed work permit for that matter. When is the next intake? That is Harmandeep. Harman, as I mentioned, we have 4 intakes in a year. So it depends on what prerequisites you need, how soon you complete the prerequisites, and then we can offer you a class to apply for. The next question is from Percival. When is the start of this LPN program? I've already answered that question. Then we have another question from Jav. I have TOEFL, is that okay? I can take CELPIP, and what grade for that? So Jav, the nursing board does not accept TOEFL or CELPIP. The only 2 English exams they accept is CELBAN or IELTS. So you'll have to take one of them. Jennifer, do you have a we already talked about it. I think, Jennifer, I already answered your question. Is there a scholarship or grant or co-op program? No, we don't have any scholarships except for the healthcare aid students who already have HCA. Purya, how to get in-person consulting session with a counselor? I'm going to put in my email address in the chat, and then you can send me an email, or you can also give me a call. I will also put my phone number in the chat, or you can write it. You can call me at 604-438-6881. Ask for Ritu, or call me at 778-549-3466. Next question is from Joy. I think if you are HC already, do you still need to take IELTS? So Joy, for that, IELTS requirement is not dependent on HCA or no HCA. IELTS requirement is dependent on either if you have 3 or more years of full-time education in an English-speaking country, you don't need IELTS. If you have education from Philippines, if you are a college graduate or a university graduate from Philippines, we help you apply for the BCI report. If you have ICS report, you do not need IELTS. But again, it is very specific to each student, and I can answer that question specifically to you with a lot of this thing that once I can only confirm it to you once we have your transcripts and once I can confirm it with the program coordinator. So set up an appointment. Next is from DeAndre. Could we please have Faith and Crystal's email or contact information again to contact them about questions? I would recommend I'll leave my email address in the chat. You can email it to me, and I'll be able to speak to Faye and Crystal or forward it to them, and they'll get back to you. Is that okay, Faye and Crystal?
I'll send in an email. If it is program specific,
Yes.
I sent out my email to them. Feel free to contact me.
Perfect. So
anything campus-wise, program-wise, I think Ritu and Faye would be the best. Anything about employment, LPNs, working in the field, you can definitely email me personally and I can help you answer that. But Faye would also have a lot of information. If you're wanting to look into job opportunities, we do hire support workers, care aides, things like that. So if you're wanting to look for job options, you can also contact me and we can see if we can find placement.
Thank you, Crystal. Next question is from Eugenia. I was born in Singapore and lived there for 20 years. I've done my schooling since young in Singapore. Can I skip IELTS and give my academic certificate and papers? Unfortunately, no, Eugenia, I don't think Singapore is considered as an English-speaking country by the board. It is?
It is.
It is.
Singapore
Oh,
is.
perfect.
Yes.
And if Singapore is yes, then you can totally.
Singapore is.
Okay.
Yeah.
So then you totally can skip IELTS. And also, if you can have a look at your transcripts, you may be able to get credits for some of the prereqs as well. So let's have a look at your transcript and then we can go from there. Crystal has already put her email address there. Rachel, I'm an RN outside Canada, but a licensed healthcare aide here, but haven't worked as a healthcare aide. Do I still need to have these prerequisites to enter the program? Yes, Rachel, you will need the prerequisites. Hubert, if one is a mature student who has done an MBA program in Canada, although not science courses, how long will the LPN program last for me if I need to learn English, maths, biology, physiology? Okay, note that I already have. Okay, so for you, Hubert, the nursing program will still be 18 months. And the English, math, biology, and anatomy and physiology courses. So English and math is 4 weeks each. And biology and anatomy and physiology for practical nurses is 3 weeks each. These are online self-paced, so you can finish them faster. However, as I mentioned before, if you can email us your transcripts for the MBA program or bring them, you may be able to get some prerequisites waived off. Again, I'll have to show it to the program coordinator and then we can confirm it to you. Emmanuel, does the student loan come with grants? So the grants are given by the government and it is based on the personal and financial situation of the students. It is different for everybody, like the mortgage is different for everybody. So again, if you can set up an appointment, visit the campus, our financial aid team will be happy to answer these questions because again, each student and everybody's situation is different. Next question is Javed. If I need extra credentials, how much are the online courses? So each online course is $150 each. How much is the tuition fee for the LPN? I've already gone over that. Percival, can you kindly repeat how the contact number? Okay, so the contact number is 604-438-6881. And you can ask for Ritu, R-I-T-U. Or you can also call me directly on 778-549-3466. We are almost reaching 4 o'clock. I'm going to see if we quickly have any other questions.
I think Reina has had her hand up from the beginning of the presentation.
Okay, Rana, so ask me your question. I think I already answered her questions. Her question was the first question. She forgot to take her hand off, I think.
Hi, can you hear me? Hello?
Yes,
Yes,
we can
Ran,
hear you.
go ahead.
Okay, thank you. I wanted to go towards being an esthetician, and I was told that I have to be a nurse or a doctor to take that path. Is that true?
Esthetician meaning you're doing Botox injection?
Yes.
Yeah, you have to go through. We had two students in the past that they have to have the license before they can do that work.
Okay.
Because that's an extra that's part of the scope of the LPN. However, they need extra education to be able to be licensed to do that.
Oh, I see. Okay. And there's no other way around that. Like you have to be a doctor. There's no courses to be able to move forward aside from being a nurse and esthetician.
Not that I know of. I'm not sure. I cannot say yes or no, but as far as I know, with the students that we had, the doctor said you cannot work here to do Botox injections and all those other procedures that they do in the clinic without having that license as a nurse.
And
The minimum to be an LPN doesn't have to be an
add, we do Botox injections at my pharmacy. We only LPNs are able to do the Botox. There is no other way. We don't hire anybody else to do the
Okay.
Botox. It's RNs, LPNs.
Okay,
Yeah.
thank you so much.
You're welcome.
So thank you. I would like to thank everybody, Faye, Crystal, and also all of you who made time to be here today. Please do get in touch with us. You're very welcome to call or to email anytime. Thank you all.
Thank you. Bye for now.
Bye.